Today on this episode of The Brain Surgeon's Take, we will be discussing what is it like to undergo brain surgery with CNN anchor and Chief National Affairs Analyst, Cassie Hunt. Get an insider's perspective on having neurosurgery performed, not only the physical experience, but also the emotional stress and mental decision making. Much more on this podcast episode. Welcome back, everyone. Here's my take on Dr. Gabrielle Lyon. She is not only a world-renowned functional medicine expert, but she is also an uber-talented educator who teaches the masses. As part of her mission to help individuals understand holistic medicine, Gabrielle founded the Institute for Muscle-Centric Medicine, a recognized center of excellence. She followed that up by becoming a keynote speaker and media contributor specializing in brain and thyroid health, lean body mass support, and longevity. As a neurosurgeon, I found this interview fascinating. I realized I need to incorporate more holistic approaches in the care of my patients. It is clear from talking to Gabrielle that the practical application of functional medicine not only improves health and performance, but also slows aging and provides disease prevention. We all need to stop looking at the human body as separate organ systems, but rather one unit that deserves complete assessment. Dr. Lyon is a leader in her field and deserves kudos for moving the needle forward. Listen up as we discuss the power of functional medicine. Check it out. Hey, Gabrielle, how you doing?
What's up, Rick? Nice to see you.
It's great to talk to you today, and I'm excited to talk about functional medicine and everything that it has to offer. I think it's a field that most people don't appreciate enough.
Yeah, I would absolutely agree with you. And what's so amazing is that for the listener who doesn't know, functional medicine is this concept of root cause. And I would say that as physicians, we're really good at algorithmic treatment or crisis situation, crisis management. But the idea of broadly thinking about how do we prevent in a meaningful way these outcomes is really, in my mind, what functional medicine is.
Yeah, I mean, would you say, I guess let's start with the very basics, because most people have heard the term but don't really know. What exactly is the definition of functional medicine?
Yeah, well, the definition of functional medicine, broadly speaking, is root cause. Is root cause. So, for example, if someone is coming to your office and they have obesity or diabetes, what is at the root of that? And it is typically in relation to some kind of lifestyle modification. Again, we can make things better or worse, regardless of our genetics, dependent on how we live. And functional medicine is root cause medicine. It is a multiple domain approach to health and wellness, which includes mind, body, and spirit, and uncovering any of those things that would be creating issues, whether it is toxic exposures, whether it is gastrointestinal issues, whether it is hormonal imbalances, etc. So it's really looking for that underlying driver and correcting it at its root.
Now, the question I always like to ask when someone has such an interesting profession, how and why did you get involved in this field?
Yeah, that's a wonderful question. So for the listener, I practice a combination. I have a concierge medical practice, which is a balance between Western traditional medicine and more holistic or alternative medicine. I say that cautiously because we are as evidence-based as they come, and we really make decisions on what the data and what the standards of care are. The practice that I have, while I will talk about it as functional medicine, is really something called muscle-centric medicine. And this is something that I developed throughout my 20 plus years of mentorship with one of the world leading experts of protein metabolism, Dr. Layman, and muscle health. He truly is a pioneer. And then in combination to doing a fellowship I did a combined fellowship at Washington University in Geriatrics and Nutritional Sciences. And what that was both clinical practice as a geriatrician and nutritional research looking at the interface between aging and obesity. All of which to say the kind of medicine that I practice, I would consider something called muscle-centric medicine. And it focuses on skeletal muscle as the largest endocrine organ in the body. You are a brain surgeon. You focus on the brain, of course, and the vasculature. There are cardiologists that identify and focus on the cardiovascular system, pulmonologists, the heart. But what about above and beyond looking at skeletal muscle as an endocrine organ? I am not talking about its functionality from a physical standpoint. I think that that is very well approached and covered, but truly from the focal point of medicine. And that is the framework of my practice. And I believe that the diseases that we're seeing in large part are not diseases of obesity. I think that these are diseases of skeletal muscle first. For example, insulin resistance, cardiovascular disease, Alzheimer's disease, these diseases that we pin the attribute to obesity are diseases of skeletal muscle first. It's impaired, dysfunctional skeletal muscle decades prior to the exposure and the revealing of these illnesses.
That's super interesting. So give us a little background. Because when you say dysfunctional skeletal muscle for
Yeah.
many decades, how is it dysfunctional? Why is it dysfunctional? Why does it lead to the problems a year, 10 years, 20 years later?
Yeah, a wonderful question. The first thing that we have to lay out is that skeletal muscle is an organ system, is an endocrine organ. It comprises 40% of the body weight, typically of a younger individual. It is important for many of the things that we mentioned, whether it was movement, posture, temperature, and glucose homeostasis, soft tissue support, fatty acid metabolism. It is the primary site for glucose disposal, especially exercise, which will allow you to utilize glucose without the use of insulin, which becomes very important. When we think about skeletal muscle, it really is our metabolic horsepower. And especially as it relates to metabolism, metabolism changes as we age, not because it inherently changes. I would argue that it changes because of the skeletal musculature. Now, you asked me, what is the role of skeletal muscle? Why skeletal muscle? What is its importance? And I think that we understand that when we go through life and we are sedentary, the body was not designed to be sedentary, that fat will infiltrate into skeletal muscle. So if you believe the biochemistry that skeletal muscle is a glucose sink, is the site for fatty acid oxidation, is the site for mitochondrial density. Obviously, the heart is a highly mitochondria filled organ, but skeletal muscle, based on pure mass, has a large amount of mitochondria that we can contribute to as we go through muscle hypertrophy. The aspect of what makes skeletal muscle unhealthy is really twofold. Number one, we decrease flux. Flux meaning muscle glycogen, the glucose that you eat gets converted to muscle glycogen. These stores should be utilized. It's almost like, have you ever packed a suitcase or a box and put it in the attic? And
And it
then,
just sits there.
right, and then it sits there, and then you kind of go and take it out, and the clothes aren't as bright, and maybe they were eaten by moths, or it smells really weird. That's the same thing that happens to skeletal muscle. Skeletal muscle is a organ system designed for movement. And if you do not move it, it becomes senescent. It becomes, there's really this disuse, this atrophy that happens. From a medical perspective, for medical providers to think, if there is a sedentary individual, many people, many nurses, many doctors will write for bed rest. Bed rest is the kiss of death. If your patient does not have to be on bed rest, they should not be. When you write for bed rest, within 7 days, those individuals have the capacity, whether old or young, to lose 2 pounds of skeletal muscle from their legs. Now, one has to understand, you asked me what makes healthy skeletal muscle, and my number one statement would be activity, because you use that flux. Activity for the reason of utilizing and minimizing these toxic byproducts that exist and remain in a static domain. If you were to Google the cause of insulin, skeletal muscle resistance, skeletal muscle insulin resistance. You will see ceramides, diacylglycerides, triglycerides, intramuscular adipose tissue. But at the end of the day, all of that stuff boils down to inadequate flux. So choose your poison, whatever it's going to be. But the reality is, if you are sedentary, there's no such thing as healthy skeletal muscle. When you are looking at the literature, and you will see the literature say these were healthy sedentary older adults, healthy sedentary 18-year-olds, they're all an insulin resistant model. Period. The second question you asked is, how do we know about the health of our skeletal muscle? Quite frankly, we don't. We do a terrible job. The other marker in which we could identify the health of our skeletal muscle would be strength metrics. The strength metrics that traditionally will be used in an older adult clinic are not adequate for the younger individuals, such as walking speed, such as the sit and stand test, such as grip strength. Arguably, I have some thoughts about it. Is it accurate or not? It is thought to be the gold standard of where someone is. I have my reservations of grip strength. Where, from a functional perspective, the provider or you guys who are not in medicine, I really would love for you to take this into your own hands and recognize that getting a baseline as to where you start. Every primary care physician should know how many push-ups their patient can do, how many squats they can do. Can they do a dead hang? Can they do a pull-up? It doesn't have to be max weight, but getting some sense of their actual strength, because remember, we train not to become better at exercise. We train to become better at life. Can these individuals do a kettlebell carry? Because a kettlebell carry may translate to carrying their groceries, putting something overhead. These things become very important. And to circle back, I'll mention one other thing. When we think about skeletal muscle health, we must think about activity, which I mentioned, physical strength, which can be measured, and then finally, lab values. And I will mention one more thing. Lab values, primarily triglyceride levels, primarily fasting insulin and fasting glucose. You may see changes in fasting insulin or glucose prior to what you would think about as disease of the muscle. So you might see these changes early before you see morphological changes. Those changes take time. And then finally, DEXA and the way in which we measure, in the brain, my friend Rick, we're so lucky, right? You could do a CT, you can do an MRI.
Mm-hmm.
We do not typically do that for skeletal muscle. Typically, someone does a DEXA, which we do not directly measure skeletal muscle mass. In nowhere else do you treat or make recommendations on images that do not directly look at the tissue, in fact, that you are speaking about. So we are not there yet. We use DEXA. We will likely never use MRI as a standard of care. It is far too expensive for routine visit. We will eventually, for the healthcare provider, use something called a deuterated creatine, a D3 creatine, which has been validated in young and old, and I'm hoping will come to market to directly measure skeletal muscle mass.
And I guess what you're saying supports the reason why that whenever someone wants to lose weight, I would say that most trainers, most nutritionists will tell you, you got to do weight training. You got to do resistance training. You can't just run or do cardio, because although running and cardio is great for your cardiovascular system, it's the resistance training and the weight training that builds lean muscle, that boosts your BMR, and that increases overall health. Would you agree? This episode of The Brain Surgeon's Take is brought to you by Vitamin Water. Vitamin water is the ideal way to hydrate, replete your electrolytes, and maintain wellness. I drink vitamin water routinely during the day in order to keep up my energy and focus. Check out vitaminwater.com for more information and use the promo code BrainSurgeonsTake for 20% off your first order.
Yeah, absolutely. Again, the question becomes, what is the quality of the weight loss? It's not difficult to gain and lose weight. I'm sure over the weekend, depending on what you're doing, many people will gain weight. I mean, the majority of that will likely be water weight at first, but the reality is to gain and lose weight is not difficult. To gain and lose quality weight takes time. And an individual should set out to lose fat or build muscle, versus losing skeletal muscle. That's like the worst of all worlds. We see that in sarcopenic patients. I'm sure you see that those individuals with more healthy skeletal muscle mass, because you see it on MRI, you will see when there is fat infiltration, those patients have better outcomes. When you are thinking about weight loss, there's two ways to do it. Obviously, nutrition and exercise, and you have to prioritize dietary protein. And there is an abundance of literature that would support high quality protein for body composition changes. We know that protein should not be thought of as a percentage of calories, but it really should be based on body weight because it is based on size, which is interesting. So, for example, the current recommendation is zero 0.8 grams per kilogram or 0.37 grams per pound. That is the minimum to prevent deficiencies in a healthy 18-year-old male. It is not enough nor sufficient to protect aging, or Rick, if someone is a post-op, this is not significant enough. The more advanced and by the way, these recommendations have not changed since the 80s. If
That's
not,
crazy.
if not even beyond that. Nowhere in medicine, you have updated protocols, we have updated protocols, but in nutritional sciences, it's beyond the 80s. I mean, these recommendations have not changed for decades. So what would be more beneficial, more advantageous is double that. And that would be 1.2 to 1.6 grams per kg, closer to 0.73 grams, 0.7 grams per pound ideal body weight. If you are listening and you grab your belly and you say, Doc G, Rick, I need to lose weight, I would say eat 1 gram per pound ideal body weight. Figure out what your total caloric load is, if you are better at carbohydrate metabolism or better at fat metabolism, and then choose accordingly. That is a very effective way to lose weight. And then, of course, the resistance training component, nothing will stimulate the body quite the same.
Now, what do you think? Well, what are the most common conditions that you personally treat in your institute?
Yeah. Well, I have a very unique practice. I have a concierge medical practice, and we take care of really elite level entrepreneurs and the warfighter. So a portion of the practice is dedicated to the warfighter, SEALs, Rangers, Green Berets, individuals that have really seen and done pretty crazy things. And then the other portion of the practice, and I have to explain the population because there is a uniqueness to this population. And then the other group, again, are entrepreneurs, mavericks, innovators. So the two groups, moms, certain people, but the one thing that all my patients have in common is they are looking to be the best version of themselves. We are not a sick care clinic. We are looking for individuals that are really ready and willing to push the envelope for their health, right? We will go to bat for them. So the conditions that we see from a warfighter perspective, we treat a lot of infectious disease. I know that might be counterintuitive to what you had anticipated, but we treat a lot of GI pathogens. We diagnose a lot of bloodborne pathogens, which again can be seen. What else do we treat? We recognize a lot of TBIs and heavy metal exposures and toxic exposures. We also do a ton of hormone treatment and weight loss. So hormone treatment, weight loss, cardiovascular disease, etc. But the primary goal for everything is optimization.
And then the question would be, why a functional medicine doctor, right? So anyone's looking for a primary care doctor. First of all, does it have to be either traditional or functional? Should it be both? Should it be
It
one
should
or
be
the
both.
other? Should
No,
be
it should be
both,
both.
correct?
It should be both. I mean, so here's the reality of it is you have to get really good training to then become creative. You can't just go to functional medicine. If someone is really a functional medicine doctor, they need to have an MD or a DO. Or if they are a functional medicine provider, they need to have a medical license, whether it's an MP or a PA. So I think that that's very important to understand where people are getting information. So if we are saying medicine, you have to have a medical degree. Again, I might be the exception to the rule, and I might be the only one that thinks that, but that's would be my personal perspective, especially being a physician myself. Now, the other thing that I would say is if you are going to a specialist, like you are a specialist. I don't care if you are functionally medicine trained or not. You are uniquely positioned to be the best at what you do. I don't care if you do functional medicine or you don't, you are a surgeon, right?
Correct.
So I don't need you to do those things. Now, where someone could really benefit is the interface between more traditional care and more functional medicine care is when someone is well trained, right? So I did, for example, I talk about this, I trained 7 years in nutritional sciences. So when someone is well trained in their scope of practice and then goes and takes functional medicine training or does additional training, that allows for a distilling of and discernment of information. And I think that is the best of the best. And when someone is going to a functional medicine provider, I think primary care is a great place to do it. I think understanding where that individual was trained, because you don't want to miss something major. And when you have a good foundation and a mastery of medicine, then you can do all these other creative things. And I think that that's important to recognize is where is the provider coming from?
And I want to go back to something you said very early, but it's super important. The science behind functional medicine. Most people who don't know what they're talking about will be like, "Oh, functional medicine, it's voodoo, there's no data, it's not evidence-based medicine." Discuss how strong the science is behind functional medicine.
It varies, but I can give you an example. And again, we talk about functional medicine as if it is the next kind of complete fellowship or training. It's not. It's not there yet. I don't think it's there yet in the same way that. So, for example, neuroscience or geriatrics, right? That is, it has a way in which those can apply. There's a standard for application. I don't think we're there yet with functional medicine. Nonetheless, functional medicine is extremely valuable, and there are evidence-based practices within functional medicine. So I will give you an example. Before anyone recognized that Lyme was a thing, so Lyme is now very common. People have neurological symptoms. People have sometimes memory disturbances, mood, visual disturbances, even musculoskeletal issues. If 10 years ago, someone were to say, this is a Lyme diagnosis, people would have laughed them out the office. And you probably see this too in your own practice. Um, Now there is evidence to support this. And now functional medicine in combination with infectious disease, we do have standards that are now more mainstream. That is evidence-based. That is one example. Heavy metals. Heavy metals were a thing where people would kind of laugh at that. Oh, yeah, you have mercury poisoning. No, now we have a standard for, yes, this can be measured. This must be reported. There's cadmium, there's lead, there's mercury. These things should be chelated or detoxed. And there is evidence to support that. The other aspect, I mean, we could go on and on. We could talk about sick building syndrome. And I actually got very sick with this. This was when I was living in New York City. I didn't realize, so there are environmental physicians, which that is an evidence-based practice that kind of exist over in a sector where most people don't think, wow, I'm sick because of my environment. You go there when you maybe had a known toxic exposure. But in functional medicine, they bring in components of environmental medicine. I lived in New York City. I lived in a water damaged building. I felt absolutely terrible. I gained 10 pounds. I'm a very tiny person. No one could figure out what was wrong. I ended up doing a mold test within the house, a mold test within my body. And again, are there still places where it would be wonderful to evolve some of the data of, okay, yes, this mold, this urinary mold sample means X, Y, and Z, and this is validated. I think a portion of us are still, the medicine is still getting there. Doesn't mean you throw the baby out with the bathwater, but toxicology and volatile organic compounds, those are known issues. Those can be measured. And that is just another example, which, by the way, I had all of these things, is just another example of evidence-based medicine within the framework of functional medicine.
Would you say that every patient should have a functional medicine doctor, whether it's integrated with their traditional primary care? Do you feel like it's something that all individuals should have at some point in their life?
I do. I think it would be wonderful, and it would be wonderful if they work together. Uh-huh.
Now,
But
I guess the
uh,
harder question is, how
yeah,
do you find the right functional medicine doctor? It's very hard to find any doctor because you got to make sure they're good and the right specialist. And
yeah.
but what's the advice to someone who's listening who's like, okay, I want to see a functional medicine doctor. Where do I begin?
The first thing that they could go to is the IFM website, and then they could look up whatever the provider. I mean, me saying that, I don't even know if I'm on the website. So, but that would be a place to start, going to the IFM website and then making sure that you are getting what you're looking for. Are you looking for an MD or a DO, someone with a medical license? Are you looking to see a nurse practitioner or a PA? What is it that you are seeing, and what are you looking for? That would be the next question, because how important is it that this provider is a physician, if or a medical provider? Because let's say you're having digestive issues and you go to a provider where versus a primary care physician that you should be scoped. Let's say you should have an endoscopy or a colonoscopy, and that is never addressed because you are not going to a medical provider. That would be a huge mistake. So I think that vetting the provider and knowing what it is that you are going for versus if you are going for nutritional coaching, then there is, making sure that that person is trained in whatever they are looking for. And I think the best is actually word of mouth. Word of mouth, finding someone who has worked with another provider, that they have a good relationship. The patient physician relationship is sacred. You need to feel connected to that person. You need to feel that they will go to bat for you, that they care about you, that you are not a number. These things are critical and also part of the healing modality.
So someone goes to see a functional medicine doctor for the first time. What should they expect on their first visit?
Lots of weird questions. Do you have a dog? Does the dog sleep in the bed? Have you ever lived on a farm? Have you were you breastfed? Just weird questions that a normal history and physical intake would not have. Have you ever had mercury in your mouth? Do you eat sushi? Do you live in a moldy place?
And then they
Is your
take
partner
that
healthy? Like the list goes on.
and then they use that to formulate what their plan is.
To tell a story. So you should be able to. So with functional medicine, one of the things I think is really valuable is you should have a story about the person. The person tells you their medical history, but their medical history is a story. It's a story of their life. And I think in functional medicine, that is invited. The opportunity to listen is there. It might take an hour, hour and a half. You might be sitting with a physician who is really getting to know you, getting to know your trauma, getting to know how you interface with a physician. The key to being a good provider, and I'm sure you can agree with this, is that it's not just about being good at diagnosing illness. It is required of you, but being a really excellent physician is being able to recognize patterns of people.
Yeah.
And when you recognize a pattern of a person, you can walk them to the other side of their goal and their dreams. So they may not be aware of their own weaknesses or their own behaviors or their own archetype, but you are, because as providers, just as illnesses and diseases show up, these archetypes of humans show up, and being able to recognize them is key. If a good functional medicine provider or any exceptional physician or healthcare provider will be looking for that. And so your questions may be accounted for in a very different way.
Now this is an important question, especially in this day and age, but is functional medicine covered by insurance?
To my knowledge, it's not. To my knowledge, it's not. But when you get functional medicine testing, I think some testing may be. I mean, we always try to use insurance. We don't use insurance in the practice, but when it comes to testing, we always try to use insurance.
Yeah, I mean it's so important and clearly the
Yeah.
benefits are so clear based on the data. You would hope that insurance companies would start to reimburse that just like they do, traditional medicine, especially if the data's there. Give us your crystal ball view, just because you've been in this field, you're one of the leaders. What are some of the major breakthroughs you see happening in functional medicine over the next 5 or 10 years?
Number one, they're going to really begin to merge this concept of muscle-centric medicine moving forward. I think the tides are turning and the ship is sailing in the direction of really skeletal muscle mass. I think we're a bit behind the times because as humans, it's interesting with a narrative, people will just repeat it. So right now, the narrative is that Ozempic, GLP, GIP-1 drugs are bad. I think in the next 5 years, people are going to be microdosing these in very small amounts. I say microdosing, probably a little bit more than a microdose, in small amounts in combination with hormone replacement therapy for the goal of longevity and body composition. This is what I think will happen. And I think right now people are just on the bandwagon of how bad, et cetera, these things are and are completely missing the mark. Um, so number one. Number two, there is going to be more of an acceptance of hormone replacement therapy. People are going to find that if you are not addressing skeletal muscle and hormone replacement therapy, then they, as a provider, are going to be archaic. It truly is going to be the next wave, which I think that we're already starting to see it, but it is going to be much more addressable, applicable, and reachable for people. I could mention something on AI, but I'm not sure where that will ever go. But I will say that the biggest direction is this interfacing between skeletal muscle as an organ system and its role in health and disease at the forefront.
That's so interesting. Just your focus on skeletal muscle, which makes total sense, but the fact that it hasn't been mainstream,
I know.
or it's
I
it's kind of
know.
crazy if you
It's
think about it.
crazy.
But looking back at what you said, so would your biggest piece of advice to someone who wants to get healthy, focus on wellness, increase activity, increase protein intake?
Mhm.
Just those two, just like
That's
that.
it. That's it. But two caveats on that. I will say calories matter. It's not just adding dietary protein to your existing diet. It is replacing some of the ultra processed foods with protein. Really, I will say if you want to get healthy, you do have to take some responsibility. And as annoying as this is, you are going to have to track and calculate what your actual needs are if you do not know. Um, you track your money, you track your blood pressure, you track your speed when you are driving, calories, you track your sleep, who knows? It doesn't have to be always, but there has to be a baseline assessment. And prioritizing protein is really, really critical. Now, the actual key to longevity is none of those things. The key to longevity is discipline. It is not protein. It is not exercise. It is not you name it, cold plunging, hot plunging, sleep. It truly is discipline and being able to surf the urge of the things that take you off track. There's a moment before a decision, and my most successful patients recognize this. As physicians, we're doing a lot of busy things. We might sit down, we might be reading a new study. The study might be very difficult, or there might be a new piece of information we're trying to learn, and there'll be a moment of discomfort. And instead of diving further into that, distraction pops up. The distraction to, I don't know, go walk and do something, go shop, maybe go walk to the fridge, you name it, right? And I'm just saying this globally. You guys plug into the difficult thing before the moment of distraction. And it's that distraction that throws people right off, throws people right off their nutrition plan, throws people right off their life plan, throws people right off of whatever dream or desire they have, throws them right off. Maybe they don't want to have that next drink, but because they were not attuned to the moment of distraction, which ultimately distraction crumbles discipline. But if you can back up and you can recognize that there is this moment of whatever it is, self-talk, you name it, right? Maybe it's a narrative, maybe it's something that makes it uncomfortable, etc., right? It's probably not in your conscious awareness yet, but there's a stimulus and then there's a moment. and then a bad decision. So if you surf the stimulus, nail the stimulus, you plan for the stimulus, then instead of doing whatever the thing is or running from the thing, you can exert discipline. That's the key to longevity. You will never be thrown off. You will never not show up for your workout because you will expect yourself to be talking out of it, etc.
Now you're talking my language because I think discipline, just like you said, is the key to success no matter what you're doing. And you mentioned cold plunging. I'm a big cold plunger. Just in 1 minute, cold plunging, good, bad, and why?
Good. I love it. For multiple reasons. And a woman or man could spend 2 to 3 minutes in there a few times a week. You could go up, I've seen some protocols that are 12 minutes a week. It doesn't really have to be below 50. There's some threshold, it could be 52, 53. It doesn't have to be 43 degrees. I think it's wonderful. I think that it cultivates resiliency, sturdiness, and grittiness. Allows you to jump in and do something extraordinarily difficult. You are never going to look forward to it. You kind of do, but you kind of don't. And you can do hard things. By the way, my husband was a SEAL for 10 years. I've never heard the end of Winter Hell Week, ever. Right? So annoying. For those of you who don't know, it's, they go into the ocean in Coronado and it's like cold plunging all day long. You never hear the end of it. So if you are a team wife, my heart goes out to you. It is good for mood. I seem to believe and have seen that many of my patients who embark on this are have less anxiety and depression, whether it is because it is a stress response, quite certainly. I have not seen data on this yet, or at least an overarching body of evidence. And I haven't looked in a hot minute, but the change in body composition, I will say that anecdotally, I do hear that people get leaner, that it does help brown, white fat. Again, I haven't, that's a difficult study to do in humans. I haven't seen the data. Maybe you've looked at it in the last year or so. I haven't, but that is definitely something that I've seen.
Well, I tell people cold plunging is both amazing and terrifying at the same time. I've been doing it now for, I don't know, 6, 7 months, kind of religiously daily, and I wake up every morning terrified. But then once I'm done, it's great. So I'm a big cold plunger. But so last question, because I know you're super busy. What advice would you give any young man or woman who wants to be the next Dr. Lyon?
Be the next best you, right? You don't want to be me. You want to be the best version of yourself. And if there is someone who, well, number one, find me, I will mentor you. We're always looking for great people. But number two is be really good at what you do and seek out the best in the field to learn from and have intellectual integrity. I think that that's very important. And be in it, not for you. It cannot be about you. It must be a message of and a true meaning of servant leadership. It cannot be about the person. It should not be about you. If it's about you, go do something else. If it's about truly serving humanity and you are deeply someone of being of purpose and being useful to other humans, then medicine is certainly a wonderful field for you. And be the best version of that. Do not take shortcuts. I took no shortcuts. Be willing to sacrifice time, energy, relationships, life to complete and do the bigger picture. And one more
Wow.
thing,
Yeah.
relationships are everything.
Oh, absolutely.
Relationships are everything. Be an upstanding citizen to the people around you and truly be a giver. And that I will tell you, my book, Forever Strong, was an instant New York Times bestseller. Do you know Rick, it outsold Atomic Habits and Arnold Schwarzenegger in its first week?
That's amazing. Why do you
I
think that
am
is?
a nobody. No one ever heard of me. I'm a first-time author. It came out guns a-blazing, and it hit the New York Times list a second time in the first 6 weeks it was released. It hit Wall Street Journal, USA Today, every list, Publishers Weekly. And do you know why it was so successful? It was so successful for two reasons, and two reasons alone. Number one, the material was really good. And number two, my friends all stepped up. They all deeply cared about the mission. And it wasn't just about me. It was
Yeah,
extraordinary.
I mean, I would agree. I would say that what you said there at the end really echoes with me about having a passion and having a vision, having a goal. I think that the reason why I admire you so much is not only have you accomplished so much in your own field, but you've really pushed the boundaries, right? You're not just going to think inside the box, but you're going outside the box. And I think that that's a lesson to anyone who wants to be great. Be passionate about what you want to do. I mean, I'm sure you feel the same way I do. I've never worked a day in my life.
I don't know. It
You know,
feels like a lot of work. It feels like a lot of work.
it's work, but if you love it, it just gets so much easier. So I would say pick something you love, pick something you're passionate about, go into it 110%. And then, just like you said, build those relationships. Like you became ultra successful because you're great at what you do, but you also built these relationships of people that respect you, admire you, and will back you up because they know that you'll do the same thing for them.
100%. 100%. And I will say it really has to be authentic. So you go there to give, and it's not a give and take. You go there to give. And, people always ask me, well, how can I do what you did? How can I do these things? And at the end of the day, I was trained by world leading experts. So I did the real work. I didn't look to be anybody else or anything else. And then I really treated and treat people around me well. People matter to me, relationships matter to me. And when you are that person, I think that that is one of the keys to my success is truly, being a friend is one of my favorite things to do. I love being a mom, mostly. 2.5 and 4.5, shoot me sometimes. Love being a mom, love being a wife, and really love being a friend. And when I think that you combine that personality trait with grittiness and education, then you
Can't be
cultivate those
stopped.
domains. Yeah.
Can't be stopped.
Yeah.
Listen, Gabrielle, what an amazing interview. Along those lines, hopefully you stay in touch. Let's be friends. I really appreciate our collaboration and I really admire everything you've done.
Thank you
Impressive.
so much. Thank you.